So I wanted to talk about steroid usage because it's a big problem and they're so overused and we cause so many problems for our animals. I've told you before about one of my patients who's a German Shepherd. Actually, I've had quite a few patients like this who have been put on high doses of steroids by other veterinarians, by the university, whatever, for, pick a problem. Generally, they're used for allergies or autoimmune problems. And particularly when they're being used for autoimmune problems, they'll be used at really high doses. And the problem with that is there are serious side effects, particularly with long-term use. So one of the things I've seen with the high dose long-term use quite commonly, particularly in larger breeds of dogs, is atrophy or shrinking of the head muscles. So the chewing muscles, the masseters, will completely shrink down to nothing. And so these dogs walk around looking like they are a skull with skin over it and there's no muscle underneath. It will also, because they lose all the muscle on their head, it'll make their eyes retract back into the sockets, and then the eyelids will roll in and the eyelashes will rub on the eyes. So the high doses of steroids in this particular scenario cause two problems: muscle atrophy and then irritated, infected eyes because of the muscle atrophy. So it's a secondary problem. But other problems that we can get with long-term steroid usage: diabetes, particularly in dogs. Cats are a little more resistant to the side effects of steroids. So I think everybody's pretty familiar with the fact that when you give steroids to your dogs, they will drink more, they will urinate more, they'll want to eat more. And that's really all the symptoms that we get. They will pant more. Those are the symptoms that we get with Cushing's disease, because Cushing's is the body producing too much steroid. So when we give steroids, we actually stop the adrenals from functioning. So that's why when your pet has been on steroids for a long time, they have to be weaned off gradually, because we have to allow the adrenal glands to turn back on and start functioning and producing the hormone again. If you have a pet who's on long-term steroids and you just stop abruptly, you will cause a crash, and they'll basically have an Addisonian crisis with vomiting, diarrhea, dehydration, lethargy, and potentially collapse. So you can't just stop. You have to wean them down if they're on for more than 4 or 5 days. So I talked to somebody the other day whose dog had been on steroids for years, every day for years, for a neurologic problem. And I don't know if they ever tried to wean the dog. I don't know if they ever tried other meds for the dog, but the dog was on really, really long-term steroids, and lo and behold, the dog became diabetic because the pancreas is wrecked by the steroids. You get high blood pressure, you get pancreatitis, just all kinds of problems going on. And so now, because we've had the dog on the drug for a long time, now we've got to treat the dog for diabetes. And so now we're stuck with 2 insulin injections a day for life because we gave a drug. So now we're giving more drugs for the side effects of the first drug, irreversible side effects, by the way. So there's a veterinarian down the street from us who his favorite drug in the entire hospital is something called Depomedrol, which is a long-acting steroid given as an injection, and it's very potent, and it lasts 6 to 8 weeks. And we get records from there where he has just given injection after injection after injection. People are coming back month after month after month after month. And instead of getting rid of the fleas or changing the diet or solving the allergy problems, these animals are then coming to us as diabetics. They look Cushingoid. And it's actually a tragedy for all these animals and for the families, because now there's bigger problems. So please, 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 please do not allow your pets to just be given steroids again and again and again and again. I have a client whose dog had autoimmune hemolytic anemia and then immune-mediated thrombocytopenia. So first the dog's body was killing off the red blood cells, then it was killing off the platelets. And so we had to put the dog on a fairly decent dose of steroids, but it was supposed to be fairly short-term, get the problem under control, and then get them off the steroids. And we can do a lot of that with herbs and acupuncture as well. Unfortunately, I mean, we have lowered the dose, but they came in 2 months ago. We told them to lower the dose at that point and said, we want to see the dog back in 2 weeks because the lab work looks so good. They waited 2 months. So now the dog's had 6 extra weeks of that dose of steroids that I wanted that dog off of that sooner. I wanted it weaned down sooner. So it got 6 extra weeks of steroids. That's not good. And so I'll get more lab work back today, and I suspect it'll be fine, and we can lower the dose again. But, you know, if your vet says, you know, okay, we're going to start weaning down, we need to recheck lab work. You know, if they say 2 weeks, please go in 2 weeks. Don't wait 2 months. I know it gets expensive, but let me tell you, the side effects of long-term steroid usage are pretty expensive and pretty awful. You know, if your pet becomes a diabetic, it's not cheap to buy insulin, buy syringes, be checking blood sugars. You know, it's a lot more trouble. So, you know, we don't want to keep these dogs on long-term steroids. I know it's easy. You've got an itchy pet. You've got, you know, a pet with IBD. Give them steroids. It stops the symptoms, but it doesn't solve the problem.